Hello and welcome to this live interaction with me, Ashish Parekh. Now, while experts fear that TB control campaigns in India and other countries aren't really going the way they're supposed to go, and also there is a lot of activity that is happening as far as TB is concerned. Now, many other countries are also suffering from the focus of most governments, because focus of most of these governments are lying on containing the COVID-19 spread. And the World Health Organization has also warned that about 1.8 million people could die of TB globally this year. Also, during the door-to-door surveys conducted by accredited social healthcare activists and fever clinics, Karnataka has detected more than 48,242 cases of tuberculosis this particular year, and of these, 19,000 or around 14,000, I beg your pardon, are in Bengaluru alone. So what does it mean for India's fight against TB? Are we letting the guard down against TB while the focus is on the fight against COVID, or has the pandemic increased awareness about TB? To speak to us more about this, we have our expert right now, Dr. Jagdish P. Kumar, who's a senior consultant pulmonologist at Apollo Hospitals. First of all, Dr. Jagdish, what do you think of the current scenario? Has the pandemic curtailed the TB caseload with people wearing masks and being more aware about their surroundings, or is it the other way around?
Yeah, thank you, Ashish. Thank you for having me on the show. It's an interesting topic, whether TB cases are going up or is it coming down. So first thing is the detection rate has definitely come down, mainly because, of two factors. One is the patient's fear of coming to the hospitals. Naturally, they might think, going to the hospital and contract COVID. That is one thing. So the detection rate is coming down.
Okay.
Second thing is, patients who are already on medications, since the accessibility to healthcare is also less. So
there seems to be a technical issue right now. We will try connecting with Dr. Jagdish back. So we're talking about tuberculosis at this point in time, and a lot of reports have come out and said that the fight against COVID might also spill over to TB, and the caseload might decrease because a lot of people are now becoming aware about how to maintain social distancing and how to also not how to wear masks, and all of these things are coming up. The more and more, the more you have awareness coming out in the people, the more it is about TB as well. And also, while we are focusing on COVID-19, the focus is also on TB, which is one of the biggest issues in India, like many other countries. And again, the fight against TB is something that a lot of governments are focusing on, have been focusing on over the past few years. But over in India, this is something that needs to be focused on. So I believe we have Dr. Jagdish back online right now. So Dr. Jagdish, in case I'm audible to you, several directly observed therapy centers that provide medicines to TB patients were closed during the lockdown, and it is believed that interruptions in treatment can lead to drug resistance, which goes on and complicates things even further. So how much of a worry is this?
Yeah, that's a good point that you have raised. It's a huge worry because drug-resistant tuberculosis is on the rise. It's a man-made disaster because, it can be from the patient end or from the caregiver end. You don't take the medications regularly, you interrupt in between, you have drug-resistant tuberculosis. That is one thing. Second thing is these patients, when the medications are stopped and when they interact with either with family members or with their friends, they can spread it to others. They can contract, drug-resistant tuberculosis, and in turn, they're spreading it to others. So yes, it's a concerning factor that most of these DOTS centers were closed, and accessibility to drugs, medicines have been reduced. So I think now we should shift from focusing from COVID to other diseases, especially tuberculosis.
Yeah. Also, doctor, while the target is to reach a case notification rate of 192 TB patients for every 1 lakh population every year, Karnataka has achieved the figure of 89 so far this year. And last year, the state reached a case notification rate of 135. So what exactly does it mean? Where do we stand right now as far as our fight against TB is concerned?
As of now, generally, not during COVID or pre-COVID, if I talk about pre-COVID, the case detection rate has been high.
Okay.
The accessibility to medicines has been good. Not only the private sector, even the government sector, if you see the medications are the same. They're absolutely the same. Good quality of medications, good quality of care. They also get, for example, if say someone is detected positive, tuberculosis positive, they get 500 rupees per month so that they can buy something for good protein diet. They need to have good protein diet. So that encouragement from the government side has always been there. But during this COVID era, when there was a big lockdown, patients having fear, why should I go to the hospital, self-medication, interruption of medication. So all this has been there. That is one thing. Second thing is, when you have to detect a patient with tuberculosis, you need to do a sputum test. And that is an aerosol generating procedure. So patient has to cough, he has to give sputum. So people who are collecting that also are in fear, right? Because whether he might have COVID, he's coughing out, I might contract COVID. So that is also a fear that, from the healthcare worker side, whether we really need to do it now or can we do it later.
Yeah.
So that also adds to the case detection rate being going low.
Exactly. Also, Doctor, before we wrap this live discussion, just a brief overview of how exactly the pandemic has affected the TB caseload, because this is something that a lot of people are finding very interesting, because, usually what you have is that when there is one scenario, when there is already one illness, the other one adding to it only aggravates it further and there is more complications. But here, we are seeing that the general awareness is increasing and also possibly the caseload might possibly go down this year when compared to other years. Is it possible?
Yes, absolutely. Caseload might go down. As I was telling you, that we will know only maybe in 2021 or 2022, because now we are following, wearing masks, social distancing. That is even good for tuberculosis, because that is also an aerosol generating and airborne disease. So one person coughs, two of them can get it. So when you wear a mask, when you do social distancing, other hygiene practices, obviously the spread also will come down. So that we will know in 2021, 2022. Definitely the number of cases are going down. Absolutely. But current situation, obviously, we were not seeing as many tuberculosis cases as before. The OPDs also have come down, mainly because of the fear, lack of accessibility and all that. But in future, I'm confident that, these practices will help in reducing the tuberculosis burden in India.
Absolutely. Thanks a lot, Dr. Jagdish, for joining us on this live interaction. That was Dr. Jagdish, from Apollo Hospitals, clearly coming out and saying that one of the facts of the matter is that, the number of TB cases have got down, the caseload has decreased. But having said that, this could be due to multiple factors. One, it could be because, there is a general awareness among the public about TB and also about COVID, and all of these things are also contributing to the fact that the caseload is going down. Or it could possibly be the fact that a lot of people are staying away from hospitals. That could be one of the reasons why the caseload that we're looking at is going down. But we could get probably a clearer picture the next year or the following year and we could probably assess the situation much better later on. So do let us know what you guys think in the comment section below, and also do not forget to like, share and subscribe to News 9 Digital. Thanks a lot for watching.